Hi, I'm Therese Scarad, Chief Clinical Officer at Columbia Memorial Hospital. In honor of National Nurses Week, we sat down with some of our wonderful CMH nursing staff and asked them to share their stories about what it means for them to be a part of this amazing profession. I hope their stories inspire you.
I have been a nurse since 1999, so a little over about 15 years this year. Actually, it's my 15th anniversary.
I've been a nurse for 9 months.
It'll be 5 years pretty soon.
I've been a nurse for 20 years.
I've been a nurse for 40 years.
3 years.
I've been a nurse for 15 years.
I've been a registered nurse for 32 years, but prior to that I was an LPN for 7.
I've been a nurse for 7 years.
I've been a nurse for almost 4 years now.
I've been a nurse for 7 years. It'll be 1 year in July.
I have been a nurse for 30 years.
I've only been a nurse 21 years.
I always knew that I wanted to be in a field that I can serve people.
All my life, I always wanted to be a nurse. My mom was a nurse. She worked at Columbia Memorial, and it's what I always wanted to do.
I became a nurse because my father was a nurse.
Initially, I was tired of cleaning houses, but then I went to school and I loved it, and I never looked back. I can't imagine being anything else.
I remembered how interested my father always was in what he did. He was fascinated by it. He loved it from the first day he got to nursing. And he always learned more. There was always this element of, going for more education, going to seminars, going to conferences, and he just ate it up. And I wanted to be that interested. I never wanted to be bored with a job, and he was never bored with his job.
I call it my midlife blessing. Something I didn't plan on doing. Had a friend that wanted to do CNA school, needed somebody to do it with her. I did it. She hated it. I loved it. Went on to school and been a nurse ever since.
I sort of happened onto it by accident. I was just, out of high school going to college and saw that there was in the college I was going to there was a program, and I thought, oh, that sounds good. I think I'll try that. Once I became an LPN, I was like, this is what I love.
I have been wanting to be a hospice nurse for the last 10 years, and I volunteered with hospice starting in '05 and was inspired by the nurses to go to school.
As a kid, I wanted to be a police officer, but by high school, I knew I wanted to be a nurse. Mom and Dad used to take me to a long-term care facility, and I really admired the nurses there, and that's where it started.
I loved people, and I enjoyed families and friends, and always wanted to be a nurse as a little kid.
I was a biology major at Idaho State University and really hadn't accessed health care. My family was really very healthy growing up. As a student, I went to the clinic there on campus. And I met this woman, and of course I thought she was a doctor, and she took care of me. And come to find out, she was a nurse practitioner. And I was really inspired by that because she changed my view of what healthcare really should look like. As a provider, she was warm and caring, and she really cared about me and helped me take care of myself. So I was just really inspired by that. And on top of it, she was just a really good role model. She was warm, caring, knowledgeable, friendly, and I thought, I want to be like that someday. So that's really where it all started for me.
I took a class with Kendra Gull, who's one of our employees here in high school, called Health Occupations. And at that point, I wanted to either be a teacher or a masseuse. and she had me job shadow a masseuse. She said, no, you need to go job shadow a nurse. And I job shadowed a nurse on the department that I work now, and I just loved it.
I was always interested in the surgery part of it, and the procedure part, and making people feel comfortable and taking some of the fear out of it and making them feel a little bit less nervous.
I have some family members who were very ill in the hospital, and I got to walk through kind of that process with them, staying with them and seeing the role that nurses play, and it's really inspiring, and I wanted to be a part of that.
I was actually cleaning a house for a lady one day, and I really respected her, and we were talking one day, and she said, God, if I knew somebody young like you, I'd say you should go back for nursing. And it just clicked. And 2 weeks later, I was moved to Portland doing my prereqs for nursing. So
I work in the OB department doing labor and delivery, and we also take care of moms and babies. And it is fantastic, high-paced sometimes. It's great. You get a lot of personal experiences and life-changing events for lots of families. It's great to see people in the community of babies that you help take care of or bring into the world. Just a fantastic place to work.
So I started with primary practice, and then I did urology, and I done general surgery, and now oncology for almost 4 years.
So I was a nurse right on med-surg here for 3 years at Columbia Memorial, and which was incredible because I went from a very large 300, 400 bed hospital to a 25 bed hospital, and was able to work with a variety of populations, kids and elderly people, and was able to float to OB, and I just thought that was the coolest thing, that I was able to learn more and expand my mind and grow that way as a new nurse.
I started out with graduating from Clatsop Community College, went up to Longview, and I didn't know what field I wanted to work in. And in Longview they had what they called a float nurse. So I came to work swing shift, and they tell me go to cardiology or surgical or pediatrics or oncology or orthopedics. So by being able to go to all the different departments, I realized that I really liked oncology. So I worked up there for 10 years in oncology and the outpatient chemo clinic.
I always liked the oncology part of urology, and that's what I done the most, urology. So I knew that I always wanted to do oncology after I got exposed to it in the urology department. So
people think that because you're in the emergency room that you don't get the bond with patients that's formed with med-surg nurses and other departments, but we see a lot of the same people often, to the point where you know them by a first name basis, and you do grow a relationship with them. I do have one patient that I took care of her husband when he died, and it was very sad. And I was there, and I tried to give her support through the transition, and it was very upsetting. And then, I took care of her on many occasions as herself. And, every time I see her, and I know which room she doesn't want to go into because it's the room her husband passed away in, and I just kind of put that to the forefront of my mind, and you just have a relationship.
It was a veteran. He had come back from Afghanistan, and it wasn't so much that he was injured physically, he was injured psychologically. He had PTSD. And the idea of losing the control that he normally held pretty closely and was able to go through life and be a father and a husband and everything, he was able to manage that all the time as long as he had control. But going into surgery was something quite different. He knew he'd have anesthesia, he'd lose control, that he might not behave the way he was able to control himself to behave all the time. He was petrified, absolutely petrified. And so once he came out of surgery, I was in the PACU, and he just couldn't stop crying. He was just horrified. He was scared to death he had done something horrible. And he just kept, apologizing over and over again. And I grabbed both of his hands, I looked straight into his face and told him, it's just you and me here. you go ahead and cry. And the two of us went ahead and cried. And he sent me a thank you note. I couldn't believe that. With everything he'd been through, he thought to do that. And people just astonished me.
The hardest thing about being a nurse is probably the grumpy patients. But then you have the sweet patients that outweigh that. But sometimes there's just really difficult patients, and I don't take it offensively. It's just they're sick and frustrated.
The thing is, I have never gone to work one day when I was feeling like I don't want to do this. Yeah, there's been days when I was tired and might want to sleep a little bit longer or something, but I've never disliked my job. I've always loved my job. So
I like that every day I'm challenged in a lot of different ways, just problem solving and helping patients go through hard times, just being there for people. You know, bad things happen, and I like to be there for people.
I guess being in this small of a community, you see the same people over and over again. You care for acquaintances of yours. And I think that's kind of a special piece that's particular to this community, is that I get to care for people I know.
The most profound experiences that I've had as a nurse have been on mission trips. I was there because I wanted to be there. I wasn't there because I was getting paid to be there. I was there because I paid my way to go and serve people in a fourth world country. You go on a mission trip thinking that you're going to, have this profound experience for the people, that you're going to bring so much to them, and the opposite happens as you walk away from the experience more enriched than you were when you went. And that's, for me, mission trips have been the most profound.
Nursing is a wonderful position, especially when you have to travel. But you need to continue education. You need to keep up on education of whatever your heart desires. You can go into all sorts of departments, and you don't have to stay where you're at, because the nursing is nursing, except you have to go for more education and training.
Number one, I'd say complete your education now. Do not wait. Do not do it in sections, because life overtakes you. If you're going to go ahead and get your bachelor's degree, get your bachelor's degree now. Go straight through. When you finish with your bachelor's degree, move on to your master's degree, and on and on. But if you don't do that, if that's not your interest, learn as much as you can in those first 5 years. Always ask doctors questions. Even if they seem intimidating to you, most of them adore teaching.
You have to have respect for yourself and who you are in your profession, and know what your role is, and know that your role is really important.
I find that patients really like it if you can share a little bit of yourself, then they're more apt to sharing more of themselves, and to be there for them, help them, compassionate, caring is probably the best.
It's a hard job. It's a hard job, but I think it's so rewarding when you get to help people.
I've had days that are hard, but I would never question why I'm doing it, because I feel very strongly about the reasons why I decided to do this, and it is a very rewarding career for me. But there's always going to be hard days, because the dynamics are always different from family to family. We always have crisis situations, but we help families get through it. And I have coworkers and other nurses that help me get through it too.
We provide not just nursing services, but that touch and that healing and that friendship and that personal touch that we have for patients.
It's rewarding to be able to give part of yourself to somebody else, and know that they're taking away something good from that experience.
I can't imagine being anything else.